The Ministry of Health is looking to toughen up rules around self-isolation to stem the spread of Covid-19. There are more than 2,000 people registered as being in self-isolation in New Zealand, with more than 6,000 having completed isolation. I spoke to the Director General of Health, Dr. Ashley Bloomfield, at a press conference this afternoon and asked him how the government's checking up on those people. When you talk about daily monitoring of close contacts, what exactly does that involve? Is it just a phone call?
Usually it's a phone call. However, everybody knows what symptoms they should be looking out for, and if they develop symptoms, then they proactively call in.
How many examples have you seen of people breaching good isolation rules and protocols?
Well, if we're talking about close contacts who are in self-isolation, because of the daily contact and close oversight, those people are very compliant with that.
Has anyone been non-compliant?
Not that I've been told of. I think in the case of others who may be self-isolating because of travel from an area of concern, I've said this before, at the moment we're operating in an environment where it's high trust. I think there's a high degree of acceptability and a high degree of social expectation that people will self-isolate. However, we are also asking for advice about what some of the other options might be to help ensure that we can enforce self-isolation more rigorously if we need to.
Dr. Bloomfield, can you clarify what you mean by looking at further steps to make sure people are isolating? What options are you looking at?
I've asked for advice on some options because I think it's something we need to ensure we know what the options might be.
So why? Are you worried that as more people are isolated that some people won't follow the rules?
No, I think what we're looking at is how other countries that have been successful in stopping sometimes quite wide community outbreaks, and one of the key actions that helps stop further spread is effective self-isolation, and what we're interested in doing is seeing how would you apply that in the New Zealand setting.
Does that include legal options to enforce isolation?
I absolutely think that would be one of the options, yes.
So what happens when you might need to shut down a school, for example? Are schools ready and prepared to teach students online, wholesale?
They're very much preparing for that sort of eventuality.
Are they ready to go now?
We'd have to ask the Ministry of Education that, but that's something they've been looking at.
And that was the Director General of Health, Dr. Ashley Bloomfield.